Hello, my name's Roxanne, and I'm going to be doing a lung and thorax assessment. Okay, how old are you?
14.
Are you a student?
Yes.
Do you have any problems with your lungs or your breathing?
No.
Do you have any cough?
Mm-mm.
Do you have any family history of lung problems or asthma?
No.
Any issues with lung cancer in your family?
No.
Okay, do you smoke?
No.
Does anyone in your family smoke?
No.
Okay, good. Okay, so what I'm going to be doing is I'm going to be assessing your lung and your thorax. The thorax is your chest area, okay? And what we're going to be starting with is I'm just going to be taking a look at you, just inspecting that area. So what I can see is that your trachea, which I can feel, is midline, okay? And you are symmetrical, okay? No abnormalities. You don't have any indentations on your chest or any protrusions. Your lateral aspect is um, wider than your anterior posterior aspect. Okay. So what we're also going to be looking at is I'm going to be palpating. Okay, so that means I'm going to be just kind of feeling around to see how things are here. Okay, so I'm going to be pressing here. You tell me if you have any tenderness. Okay, there's no lumps or tenderness. Okay. Okay, and I don't feel any crepitus. Okay, and your breathing seems to be fine. Are you comfortable with your breathing?
Yep.
Okay, and your lips are nice and pink, and your nails are normal color, so you don't have any signs of what's called cyanosis, meaning that you are lacking in oxygen. Okay, and what we're going to do is I'm going to we're going to check for fremitus. Okay, so what you're going to do is I'm going to have you turn over this way, and I'm going to have you say 99.
99.
Again.
99. 99. 99. 99.
Okay, good. Okay, and I can feel the vibration, which is what we're supposed to be feeling. Okay, and then what I'm going to do is I'm going to be percussing the back of your chest, and then we're going to be percussing the front of your chest. So you're going to feel me just tap here, okay? Okay, and I'm listening for resonance. That would be her lung field. And if you would find dullness, you want to make sure that you're not over the scapula, which your scapula are here. Dullness would be over the scapula, or if she has any consolidation. Okay? So what I'd like you to do is take a deep breath in and hold it. Okay? And I'm just going to keep tapping, and I'll tell you when to breathe. Okay? And hold. Okay, there's the dullness. Okay, you can breathe. Okay, so we're about right here, and I'm going to have you do the same. Okay, there's the dullness there. Okay, it should be about even. The right might be a little higher than the left. Okay, now what I want you to do is I want you to take a deep breath in and then blow your air out and hold it out. Okay, hold it out. Okay, so now I'm going to go up. Okay, so I can hear the, okay, you can breathe. Okay, okay, and then blow it out and hold it out again. Okay, and the change is about there. So the change should be about 3 to 6 centimeters, which is what is normal. Okay, and so I'm going to have you turn this way again. Okay, and this time what we're going to do is I'm going to be listening to your lungs, and I'm going to have you sit up straight. Okay, and I'm going to start out by listening up here because this would be your upper lung area. Okay, so you can breathe in and out. Each time I put the stethoscope on you, I want you to take a breath in and out through your mouth, like, okay, go on. Okay, you can turn around, and what I'm expecting to hear is vesicular breath sounds, okay, and possibly some bronchovesicular up high. Okay, so again. Okay, good. You can turn. Okay, and so another thing that I'm going to do, what I'm also listening for, I'm hearing vesicular breath sounds, so that's good because her lungs are clear. But the other things that you could hear crackles, whether they be fine or coarse. You could hear wheezing. You could hear a friction rub. So now we're going to check vocal resonance, and the first thing is called bronchophony. And so what I'm going to do is I'm going to have my volunteer say 99 each time I place my stethoscope on her back, okay? So
99, 99, 99, 99, 99, 99.
Okay, so what I expect to hear is I can hear her saying the words, but it's not exactly clear, and that's normal because if she had a consolidation, that's when you would hear it very clearly. Okay, so the next thing I'm going to have her do is called whisper pectoraloquy. Sorry, I can't say that word. And so she's going to whisper, and I'm just going to have you whisper something like 1, 2, 3. Okay? So you're just going to say it quietly, and again, every time I put my stethoscope on you. Okay, okay. So what I'm expecting, again, is that I'm not going to hear anything. So that's good, because I would be hearing something if, again, she had a consolidation, and that could be pneumonia or it could be a mass. Okay? And the last thing that I'm going to have her do is called agophony. So I'm going to have her say E each time I put my stethoscope on her back. And so let's do that next, okay?
E, 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 E.
Okay, good. So that was normal as well, and what I should hear is her actually the E sound. It shouldn't go to an A. If it goes to an A, again, that would be an issue. That would mean that there might be some sort of consolidation. Okay, so this finishes our assessment of the lung and thorax. Thank you very much.
You're welcome.